Hey guys, ChiroFit Health and Wellness, Dr. John here with Amy, our fantastic trainer, and we're going to go through a couple of things with back pain. We get a lot of people obviously at a chiropractic clinic that are having back pain, and some of that is back pain from bulging discs, from muscles that aren't firing correctly. From a previous video we were showing anterior pelvic tilt. There's lots of different equations here, and so what we're looking for specifically today is when you have your back pain here and it's staying local, or it's shooting down your leg, or it's just staying in this general area, that's kind of a back pain that can be associated with disc stuff, with facet injuries, a lot of different stuff that we're going to focus away from today. We're actually going to talk about a muscle called your Quadratus Lumborum. It's a huge, strong muscle. It's called your hip hiker. Kind of does this, and it connects from here, like where your hip is, and down in your low spine, comes up to where your rib cage is and your lower part of your lumbar vertebrae are. And so it's a very strong muscle, and it actually works with that anterior pelvic tilt. So if you have anterior pelvic tilt and it's doing this, your body doesn't want this to continue. So what we'll try to do is fire that muscle to pull you back into extension. Well, the problem then is that not only do you have that anterior pelvic tilt like this, then you're crunched back like this, and you get the back pain that goes right here. So very specific people will say, yeah, it's right up in there, or when I turn my neck here, I can actually feel it down here, and it's just in a very specific area, whether it's the right or the left side. And so what we're going to show you today is a very good stretch for this. There's a lot of different stretches with the QL, but this is one of the best ones. So I'm going to have Amy just kind of go down on the floor here. What we're looking to do is do a 90 degree with this leg, 90 degrees with that leg. And so let's say it's your QL is tight on the right side, your left leg's going to go down to the floor first. So we're going to work with Amy here. So this one's going to kind of go out, this one's going to go out like this, and then she's going to turn her body and lay down on this elbow, and then stretch this one up and over. You feel it stretching out here. And so now what you can do, if you have a partner or if you have a band, you can have the band actually pulling and distracting, or you can have your partner just very gently kind of pulling and distracting to kind of give that QL an extra stretch right there. And you might have to actually go into some different positions where Amy, she might feel the stretch more like this, but just know that everyone's body's not different, or everyone's body's completely different. So you might have to stretch, have your chest up a little bit more and pull. You might have to kind of be down in this corner a little bit more and pull. You might have to be in a few different angles for that. This also is a good stretch for some of the glute medius, the piriformis, but it all depends on your angles. So you kind of move around with that angle. Now the minute you start to feel it stretch and pull on your rib cage and your low back, that's the QL that's stretching. So you want to do a little bit of that stretching on your own, and then do some assisted stretching. So if you have a partner, if you have a trainer that you're working with, they can kind of do some of that assisted stretching with you. And just be careful, especially when you're sitting in that position for a long time and then you come back out of it, slowly come out of that stretch, because you're stretching a pretty major muscle of your spine. So you want to be very careful with that. So thank you very much.